So welcome to the tiny desk version of the Viva Eve Podcast. I have Alexa here, a nurse practitioner here at Viva Eve. Okay, we are talking about endometriosis, my favorite thing, because I have it. I basically started going through endometriosis pain as soon as I got my period. And I didn't really get diagnosed until I was almost 30. It was just the worst, most debilitating period pain ever. But can you tell us from a clinical standpoint, what is actually happening when you have endometriosis inside?
Ultimately, what's happening is the endometrial cells are growing outside of where they don't belong. There's an endometrial lining in your uterus, and then what happens is those little cells start to migrate outside of the uterus. It can be as extensive from like the bowel to the bladder to the pleural space in the abdomen area as well.
And because like when you get your period, those cells are trying to basically get out of your body, which makes it so painful, right?
Correct. They're trying to like shed, but there's nowhere for them to shed.
Right. We tend to normalize pain a lot as women. At what point would you say to your patient, it's not normal, go see a doctor, come see me?
If you're having cramping during your cycles, even prior to your cycles, and it's so severe that even just ibuprofen or over-the-counter Tylenol, Midol isn't cutting the pain at all, then I would say that's when you should address that with a medical professional. Ultimately, periods, yes, you're going to have some cramps, but they shouldn't be debilitating. You shouldn't be down for the count for days. You should still be able to like function throughout your life.
Yeah. I remember not being able to go to work. I missed 2 to 3 days of work a month. I couldn't drive a car sometimes. And then I had an emergency surgery where I had to get opened up. And they were like, oh, by the way, while we were in there, we took out a bunch of the endometriosis, what you call like tissue.
I kind of describe it as like needing to like scoop out little areas of growth.
What do we do here to help our patients?
If you are having the pain, you can come in, we can give you an ultrasound, take a look. If we see some things that look suspicious of endometriosis, we'd want to do an MRI to then further evaluate, because the MRI is a better imaging of the pelvic area. And then that can also pick up on some abnormalities or endometrial tissue growths. And ultimately, the gold standard is like that laparoscopic surgery to really be able to go in there, look around, and also remove if necessary.
Okay. And we do that at the hospital?
Correct.
Great. Okay. Thank you so much. I love you. And baby's coming.
Yes, baby's coming.
All right. Well, we'll see you next time. Thank you so much for taking time.
Yeah.
And if you're going through it, ladies, get your cute little butt in here. We'll help you out.
Yes.
All right. Bye.
Bye.